Mouth care is something we have done all of our lives, from when we first got our teeth till we lose all our teeth if we do. A wonderful routine that we begin our day and end our day with, and it's important for persons living with dementia to continue that mouth care. I think it depends on the person, when they feel comfortable. If, we all either brush our teeth before we eat breakfast or after. Some people prefer it first and some people prefer it after. So find out from your parent or grandparent what's their preference. What the research shows is electric brushes work pretty well in the beginning stages, but in the end stages, because they make noise, people are not sure where the noise is coming from, and they're not certain about the movement in their mouth because they're not making it move. So again, you have to just be aware of where the person is in the disease so that you can judge what they need. One tip, that is, use soft, bristled toothbrushes. It's important because the gums get more sensitive the longer we live, just like all our tissues. And so we need to use the softest toothbrushes we can find. Even a child's toothbrush might be as appropriate as an adult's, particularly if you're helping somebody brush their teeth, because it's easier to manipulate a smaller toothbrush than an adult size. So to help a person brush their teeth, you need to give very simple instructions. Here's your toothbrush. Here's the toothpaste. Shall I put the toothpaste on your toothbrush for you? Put their hand around it. Sometimes if they're in the later stages of the disease, you might want to stand behind them and help them move their hand and toothbrush with your hand over their hand. You watch and you see what they're doing, and as the disease progresses, people can do less and less, so you might need to mirror the brushing using your own toothbrush and saying, good job, you're doing it correctly. Eventually, you may have to do it for them. Over time, you'll know how much help people need. When people are at this stage where they want to bite down on whatever is put in their mouth, you probably don't want to help them floss anymore, and they may not have the dexterity to do that. So there's some things you can use that you can get at the drugstore that are look like flat toothpicks with a little spiral brush on the end. Gets the teeth clean, and it's much less likely that you're going to be bitten. Let me share with you an encouraging thought in doing mouth care. If a person is resistant, clenches their teeth, don't fight them. You might try a couple of different techniques to see if they will respond in a different way. One is to just take the toothbrush and put the toothpaste on, and automatically people may start brushing the teeth. We've seen that. Sometimes if you rub their cheek, it relaxes them, and they'll open their mouth, and you give them the toothbrush and they'll brush their teeth.